So GFR, or glomerular filtration rate, is the single best indicator of kidney function. Normal values relate to age, sex, and body size. Adult males, are going to top out at 130 mils per minute in terms of filtration rate, whereas females are going to top out at around 120 mils per minute. So as the kidneys age and as your patient gets older, your kidneys become tired. Being 70 years old, your creatinine clearance, or GFR, is going to be lessened, almost to the point where they are considered a chronic kidney disease patient, even though they have normal for their age GFR. Does that make sense? So the way we measure GFR is we measure it as a urinary or plasma clearance of an ideal filtration marker. We're talking about radio-labeled markers and indicators. It takes time. That's expensive. As a surrogate, we have creatinine. Okay, it's an amino acid that's derivative of muscle breakdown, and it's freely filtered by the glomerulus. The concentration of serum creatinine is a function of creatinine production as well as renal excretion. So keep that in mind. So creatinine production. So what produces creatinine? Muscle, right? So if I'm Dr. Woodis, right, and I have all my muscles, which I do not, right, his creatinine is going to be higher than my creatinine just by the fact that he has more muscle to break down than I do. So aging, as we get older, what's going to happen to our kidneys? They're not going to process the creatinine as well. So our GFR, our serum creatinine, most often, because I age, what's going to happen to my muscle mass? It's going to decrease. So what's going to happen to my general serum creatinine? It's going to decrease. Female sex, me compared to Brock Woodis. Who has more muscle mass? Women are going to have a lower serum creatinine, potentially, or more often, than males because of less muscle mass. Race, as compared to the white race, blacks typically have an increase, just as a baseline serum creatinine. Hispanics and Asians tend to have less, lower. Again, body habitus, so muscular, you're going to have an increase. Amputation. If I don't have a leg, that's going to obviously decrease because I don't have a lot of that muscle. Obesity, there's no change in serum creatinine. Chronic illness, so like malnutrition, inflammation, or just plain deconditioning, you're going to see a decrease in serum creatinine. Also, your neuromuscular diseases. So in your muscular dystrophies, in your patients that have cerebral palsy, and then vegetarian diet is going to be a decrease, and ingestion of cooked meat is going to be an increase. So why did I spend a good couple of minutes going through this slide with you? Exactly. So you can't base somebody's kidney function solely on their creatinine. So that's why we need to look at the whole patient, okay? So if I have somebody that comes in that's 21 years old, and their serum creatinine, it's a male, and their serum creatinine is 0.3, and I do my math, and I come up with their creatinine clearance is 280 mils per minute. Number one, is that true? No, right? Because what's the max that we cap out at? Essentially, like 130 for males, okay? So max is probably at 130, but then what else? Does 0.4 or 0.3 seem normal for a 21-year-old male? No, okay? So then we have to start doing more information, right? What else is going on with this patient? Well, he had a gunshot wound and now he's a paraplegic. He's been a paraplegic for 3 years. Well, that can certainly affect that, okay? And now I don't know. Maybe his baseline serum creatinine is 0.2 and now he's 0.4. So that could be an acute kidney injury, but we wouldn't necessarily know that because we didn't think about their whole, the patient as a whole, right? We're just looking at numbers, okay? So we can't look at numbers. We have to look at the patient.